Hi, I want to welcome Art Kaplan to Tabernacle Talks. Art, if you would love to introduce us and tell us a little bit about yourself, I would just love for you to share with the group your background.
Sure. So I'm Art Kaplan. I'm the head of what's called the Division of Medical Ethics at NYU's Grossman School of Medicine in New York City. Some of you may be thinking, what's medical ethics? We look at issues that come up around everything from bedside patient care, privacy, getting informed consent, your permission to do research or to give you treatments, all the way out to policy questions such as should we allow people to genetically change embryos to try and get rid of diseases? Is that the right thing to do? And obviously with COVID, many questions about vaccines and new medicines, and what about ivermectin and alternative medicines. So those are areas where we do surveys, we try to figure out what people are thinking, then we put together research groups and try to come up with some answers.
That is amazing. And I think that's great for the audience to understand that there's someone like you working in the healthcare system to answer those questions and to hold leadership accountable for a lot of the decisions that are being made. There has been a lot of information on social media right now regarding access to healthcare and who should have access. And I was reading Reddit the other day, and there was a person that was just ranting that anti-vaxxers have made a choice. And so if you get down to scarce resources, say there is an issue of scarcity of beds, that the anti-vaxxers should not be given beds. What would the ethical response to that kind of opinion be?
Well, you know, every semester I teach our med students at NYU that it's not their job to figure out who's a good person and who's a bad person, who's virtuous and who's a sinner. We treat them all. The ethic has been, your job is to make people better. Medical ethics in America has always been you treat everybody, regardless of race, religion, credo, gender, bad behavior, good behavior. And our job is to make people well. Even in war, you wind up treating the enemy who is trying to kill you and try to make them healthy if they suffer injuries. So I like the ethic that says we don't make judgments. And I'll tell you why pretty simply. It's often hard to do it. You don't know whether the person didn't take a vaccine because no one brought them one. Maybe they couldn't get a car to get to the place. You don't know whether they're under a false information. Somebody told them a lie and they believed it. So not everybody is equally responsible when it comes to something like non-vaccination. That said, here's something to think about. If it's true that people who are not vaccinated don't do as well in getting ICU treatment, they die faster, would that make a difference to deciding who gets a scarce ventilator or a scarce bed in the ICU? It could, not because they're bad, but because you try to give in an emergency or what we call triage, meaning allocating a very scarce resource, you try to give it to where it's going to do the most good. Wow. Non-vaccination might reduce your chances of being able to survive.
Wow. I hope people in the audience heard that, because that's something I wouldn't have thought about. I know that there have been this debate when you talk to some of the anti-vaxxers, they were talking about we don't want to take an unapproved or an emergency use drug by the FDA. And we now see that we do have an approved vaccine from the FDA. Do you think we maybe shouldn't have anticipated there would be all this angst when you had an unapproved emergency use drug?
Well, I think people felt that COVID was killing so many people and putting so many people in the hospital that they would just take any vaccine they could get. Emergency use approval wouldn't deter them or stop them. They'd want to get vaccinated so they didn't get sick. But people were so afraid, so worried. There's so much nervousness about vaccination in particular. That didn't turn out to be true for everybody. It turned out to be true, by the way, for a lot of people. We did get a lot of vaccination done.
Yeah.
But remember, emergency use was a little bit deceptive, because in the past, it was used to approve a drug in an emergency that you might have given to 500 people. I think it's been used in history of the United States 10 times. This was used for a vaccine that was given to hundreds of millions of people. And we had data after we gave it to him showing that it was safe, showing that it was effective. I never worried too much personally about emergency use, because in this case, it was like emergency use for 200 million people. We never had data like that. And so it was looking great. It still looks great. If you said to me, what's worse, the vaccine or COVID? COVID wins that easily. That fight goes to COVID, much worse.
Much worse. We talk about we live in a democracy and that we have freedom of choice. And I think we've never seen democracy exercised more than this whole issue regarding vaccinations versus non-vaccinations. What would you say is the greater good?
Well, I'm a little sad that there are a lot of people, some professional athletes, some your neighbor, who say, I'm not going to vaccinate because I don't want to, and it's my choice. When you come to infectious diseases, when things are spreading around in the community, it isn't just your choice. Look, a lot of people who died from COVID were in nursing homes. They rely on everybody else to get them food, to take care of them. If we don't vaccinate the staff, they're going to die in big numbers, and they did. There are a lot of people out there who have immune diseases, HIV, they had a transplant, they have cancer. They can't get vaccinated. Vaccines won't work on them. Their immune system is weak. The only way to protect them is for your neighbor, their neighbor, to get vaccinated. So COVID is a community challenge, not an individual challenge. And I don't think it's right to just say, I'm going to do what's right for me. I think you have to say, I'm going to do what's right for everybody, all the people in my family, in my neighborhood, in my community. You got to take them into account because they need you to protect them. They can't protect themselves.
Wow. You talk about the implications of man not being an island and have a greater responsibility. And we also talk about the employers that need to have that greater responsibility as well. So when employers are trying to vacillate on, do we have a mask mandate, do we not? And we're seeing this debate across the country. What would you say to those employers? Do they have any liability for not implementing some type of mask mandate?
Well, if your boss says you got to come into work, you got to come in and drive that bus, you have to come in and be a secretary, you have to be here, and they don't keep you safe, then they're responsible. We have 100 years or more of efforts to push businesses to make workplaces safer, get rid of the pollution in the air, get the asbestos and lead out of the environment, put on a hearing protection if you're working one of those jackhammers. Businesses didn't like doing that. We had to make them do that. We also had to make them do things like get the kids out of there, no child labor, because they were really exploiting young children in mines and things. So vaccination and masking are part of workplace safety. The boss should try to make your work as safe as you can, and I believe should not bring you back unless they've met that requirement. One other thing.
Wow.
We think about masks, we think about vaccines, but the other thing to look for and maybe even to ask the boss is, are you going to test us all? The more testing you do, the more you can tell somebody go home or stay home if they do get COVID. So that's an effective strategy as well. I think some of us have gotten so wound up about vaccine mandates that we forget it's much easier to say, go home, or if you don't feel good, stay home.
Stay home.
Right? Those are very good protections.
I think by now everybody in the country knows what the term, or at least they've heard the term quarantine. And we know that one of the obligations of a person who's tested positive for COVID is that they're placed on some type of quarantine. What would you say about the person who is positive and they are supposed to quarantine, but say they're out traveling, they're out doing all the things they normally do? Do you think there should be any type of liability or penalty for a person that does that?
Well, let me give you a case. There's a teacher a couple of weeks ago, knew she was positive, went into school, no mask, no isolation, taught class. The first 2 rows of her class got sick, the kids. I think that's a lawsuit. I think she should be held responsible. She did the wrong thing. She should not have gone to work at all. And if you make me sick and you know you're positive, you know, we have laws on the books. People forget this. If I have HIV and I have sex with you and I don't tell you and you get sick, I go to jail. In 45 states, there's a law that says if I don't warn you, then I'm responsible if I hurt you. Think of this another way. If you lived, I think you're in Ohio, right? So you get snow like I do here in Connecticut. If you don't shovel your walk, you don't shovel the stairs and somebody falls down, they come after you, right? You're responsible.
Yeah.
Similarly with vaccines, you don't protect yourself, you don't protect them, you don't vaccinate, and they get sick and they can trace it to you. That's responsibility.
Wow, thanks for sharing that, Art. Okay, well, let's talk about the HIPAA privacy. You know, we all know in healthcare, I work in healthcare, you work in healthcare. HIPAA is that thing that we always drum in everybody's head that people have privacy laws. Now that we're in a pandemic, we're seeing a little stretching of those privacy laws when it comes to contact tracing, because if you're positive, I'm going to contact trace and ask you who you've been around. What do you think are the ethics? Do you see reduced privacy, and is that appropriate for the betterment of public good that I have to ask you who you've been around and where you've been, and you really should have to tell me?
So a couple of things when it comes to privacy. HIPAA applies only to doctors, nurses, hospitals, and insurance companies.
Yeah.
They're not supposed to leak information that they get examining you or from your record. Okay. Does that mean I can't ask you if you're COVID positive? No, there's no law that prohibits that. Does that mean you have to answer me? No. But anybody could ask anybody. It's the law of HIPAA applies to healthcare institutions, nursing homes, and their employees.
Okay.
Your boss can ask you. And here's something that people forget. If I'm the boss and I say, are you vaccinated, Michelle? And then people say, well, I'm not going to answer that. You know what the boss can say? You're fired. The boss doesn't have to employ you. It's at will, as we say. Hey, I didn't make these rules. I'm just telling you. Bosses have the right to hire and fire. They're not supposed to discriminate. They're not supposed to be biased about who they hire and fire. But if they just say, anybody won't tell me if they're vaccinated, that's not a protected category. That's not like protecting somebody's religion. So they can fire you. So they expect an answer, and you better be ready, I would say, to give an answer, or they may just assume I'm not going to answer is a no. The other interesting thing about privacy, yes, in an epidemic, in a plague, you have to contact trace. It's one way to get the thing under control. So yes, I do want to know who you've been exposed to, who's been around you, not because I'm going to take away their insurance or harm them. I just need to know if I need to isolate them too, or if they're starting to show symptoms, do I need to tell them, here's when you go to the hospital. If it only gets this bad, stay home. So yes, you do need to have more knowledge of public health people about what's going on. But remember, they're supposed to keep all that confidential too, and they get penalized or fired if they leak information about who they trace.
Okay, that's good to know. So anybody out there, if you don't know what the at-will employment doctrine means, you better look that up if you live in an at-will employment state, because Art is absolutely correct that you can be terminated if you don't follow the mandate of an employer. And vaccination, we're seeing that as a mandate across the country. Okay, you're in healthcare, and we talk about extraordinary treatment, and you brought that up when you mentioned triage. If I go into a healthcare facility and we're now talking about extraordinary treatment, that they could potentially withhold treatment if they feel that my outcome is less than satisfactory, what would be considered an extraordinary treatment to prolong my life, where someone like you is going to be brought in and make a decision about whether I get care or not?
Ventilators, hard to operate, need a lot of technical skill. It's not like just putting a mask on you. You have to intubate the person, keep the airway clear. It's a hard thing to do. That's going to be considered extraordinary care. Kidney dialysis. a lot of people involved, a lot of chemicals involved. You got to do it 3-4 times a week. Pretty high tech treatment, even though many of us are just like, I don't know, I get it every week. It doesn't seem all that extraordinary, but it can be time consuming and resource intensive. Remember, if you're running a hospital and you get an overwhelming number of patients, you can only do so many kidney dialysis patients because there's only so many people who know how to do it. There's probably only so many machines, and you need a nurse and you need the chemicals to make the machine work. The toughest things I've seen in NYU hospitals, and we're a big system, we're in Long Island, Brooklyn, and in Manhattan, we almost ran out of just the basic chemicals to do dialysis. A lot of people think, well, I get COVID, my lungs are in trouble. Your kidneys can be in trouble too.
Wow. You are a wealth of information. I hope people are taking notes out there. Let's talk about when a non-medical person, because people are being offered treatment in hospitals every day. And I'm assuming they get informed consent for certain procedures.
Let's hope.
Is it
If they don't
assumed,
get consent from you, call me up. I'll be there.
do we assume that the person has the capacity to make that decision? And how does the provider assess that the person or the refusal that was based on reasonable judgment?
That's a great question. The presumption always is that you do. It's on the healthcare provider to prove that you don't, or come up with a reason why you might not. Now, at one end, people come in an ambulance, they're unconscious, they're clearly not giving us consent. We might look around for the family, but you're not always sure whether the family has the best interests of the person at heart. So sometimes you're trying to pick, is it the sister, the grandma, the boyfriend, who's the right person to run the show? Occasionally people say, well, let's all decide together. In my experience, that never works. You have to pick somebody to do it. Otherwise, they fight all the time, and you don't have time with a sick person to work all that out. Then you have people who are children and people who have disability, mental disability. So clearly, we have to make decisions for them. Again, usually the parents. Sometimes a court gets appointed. If you think that the parents have neglected the kid or harmed the kid, you're probably going to go to a judge and get a court order to take decision-making about medical decisions. I've done it. It's not fun, but I've done it. And then you have people with psychiatric and mental illness, and that's a tough one. We often call in a psychiatrist. I'll tell you what they look for. Two things. One, are you consistent in what you're saying? So if you're all over the place, they tend to think, that's what we call authenticity. It doesn't sound like you really mean it, or you have a consistent value here. Let's say you say, Jesus is talking to me, but the next minute you say, Art Kaplan's talking to me. And the next minute you say, Putin's telling me what to do. That would not be considered a strong example of a dedicated religious belief. Whereas if you said the same thing again and again, okay, then, I might not agree with it, or somebody else might say, I don't hear that message, but it's your message. You're going to be deemed competent. The other thing to look for is, do we know that you underwent any injury, any type of trauma that might have put you off your game? So you're in a car accident, or you saw somebody shot and it freaked you out. That's the other reason we start to think, we're not necessarily going to follow what you say. One other little trick, and I've done this. You may say, no treatment, I don't want it. But if I think I can save you, I'm going to push a lot harder than if I think it's kind of hopeless. Then I might give you more leeway to say I don't want any treatment. Can I tell you a little story about Jehovah's Witnesses?
Sure.
I had a guy who was in a bad car accident, lost a lot of blood. He was going to die, no blood. His wife was there, his religious leaders there. He had somewhat older kids. I think they're 18, 20. They're all there. So we got to give you a blood transfusion, you're going to die. I don't want it. Jehovah's Witnesses do not accept blood. So they call me and say, do we have to honor his refusal because he's going to die? And I say, yes, we do. He's not incompetent. He knows where he is. He knows his family. He's saying it again and again. And that's what we decided to do, to let him go. But I don't know what little voice, little birdie went off in my head after we left the room, and I went back and there was nobody there but him. And I said, "Now, you sure you don't want blood?" And he said, "I do." He would not admit it in front of his family or his religious leader. So a trick I've learned is you always got to get them in a private environment to make a decision and promise them that you'll keep it a secret.
Wow. Amazing story. Wow. Okay. There has been a proliferation of marijuana across the country. And we know at some point, marijuana was an illegal drug that a lot of people are serving jail time for. We also know that the pharmaceutical companies now have been under fire from major metropolitan areas and local government for their role in distribution of opiates. I'm seeing that those large pharmaceutical entities are being allowed to settle the distribution of drugs when we didn't really see those kind of settlements for the street drug peddler. What are the ethics of that when the outcomes were similar?
Well, the Sackler family in particular, with OxyContin, reached a big financial payout with the feds and others for the opiate epidemic, and basically spreading false information that the drugs were safe and non-addictive. They got off too easy. They should be in jail. Just getting the financial penalty to them means nothing. They have so much money, it won't make any difference. The street guys, or somebody who drove the car on a bust, a marijuana bust, I think you got to let them out. It's not fair to hold them responsible for something we decided is legal. As long as they didn't commit any violence, as long as no one was harmed. If they're just 3 times and out dealers, you really want to keep them in prison and spend the money to house them? I think many of them could go to work. I hate to say it. Some of them are pretty good businessmen,
Yeah.
And women, so you could probably get them out doing other things. But no, it's one of the great injustices of America that the rich, the billionaires, seem to have bought their way out of this.
Wow. Okay, we hear about racial disparities in healthcare, and I think we see whenever there is a significant health emergency across the country, there are certain populations who suffer more. Why do you think, or do you think there have been enough resources targeted at those groups that have always seemed to be left behind or not engaged when it comes to public health issues?
Well, America has made an ethical mistake. It has made healthcare something that you earn by getting it through work. So it's like you work and then you deserve to get health insurance and access to healthcare. Healthcare should be a right. Doesn't matter whether you work or not. And by making it part of work, every time somebody gets a job that doesn't have health benefits because it's part-time, they're not covered. There are people working 2 and 3 jobs, low-paying ones that don't offer health insurance because we don't require the company to do it. So look, America says you are a country that has equal opportunity and we want everybody to achieve what they can achieve. Can't achieve it if you're sick, can't achieve it if you're disabled. Healthcare helps reduce those problems. You know, you go all the way back to Obama and him pushing for Obamacare. You know, he didn't say very much that healthcare is a right. I believe you're going to have equality of opportunity in a capitalist society, then everybody must get basic healthcare. So I mean, everybody gets the right to get a face transplant or experimental drugs? Probably not. Mm-hmm. Get your gallbladder taken out, fix broken bones. By the way, dental care, which is hugely important for older people in particular. Yeah, you need to do that unless you're really going to be hypocritical and say, well, everybody can compete. It's just that some of us have to compete from a wheelchair that they had to buy on their own.
Wow. Okay, I'm aware of municipalities across the country that have declared racism a public health crisis. Why do you think municipalities are finally recognizing this, and what do you think took so long?
Well, I'm not always sure that I think racism is a public health crisis, and I'll tell you why. You don't like putting everything on the health system. Racism is partly a housing crisis. It's an education crisis. It reflects itself in many walks of life that, say, doctors and nurses can't do anything about. I'll give you a practical example. There are a lot of differences in nursing homes. Rich people get nice ones. Poor people get not so nice ones. But that's housing. I never think of a nursing home as like all that medical. It's like where you live. And yeah, there are things that happen there. The doctor may come around to check on you because you're old. But I think of it as a housing thing. So for me, well, let's put it this way. You could say racism is a public health problem. The weakest part of our health system is public health. So putting it in that draw, I don't think is going to help a lot.
You have been like a walking history lesson, and I'm sure people are sitting there and they've taken amazing notes. I always give my guests the last word. What do you think is important for us to understand in terms of why ethics in medicine and healthcare is important, and why someone like you is so important to the responsible delivery of care in our healthcare system?
Well, ethics, and here I would include religion alongside secular thinking about ethics. It's important because health is a community achievement. Health is something for prevention. Parents have to work with their kids. Schools have to promote health. That's a lot of the ways in which people see a school nurse, which we've been getting rid of, but is in my view, a terrible mistake. You have to basically pull together to achieve health. And the COVID thing reminds us how true that is. It doesn't matter who you are or where you are. If the whole community isn't pulling together, you're at risk. So the moral requirement is look out for your neighbor. The moral requirement is take care of yourself. And the moral requirement is don't kill the weak and the vulnerable, meaning children or the elderly or people who have chronic diseases. It's basically an ethics fight. That's what the COVID battle has been all about. And it's a reminder, healthcare has a key driver. It's the ethical component, whether it's spirituality when people, your relatives are dying, or whether it's just basic ethical commitment to say, I'm going to spend the money it takes to make sure my neighbor gets basic healthcare.
Well, all right. Thank you so much. This has been just an eye-opening conversation with you. And I want to thank you for coming on Tabernacle Talk.
Pleasure.
I know you are busy, and the fact that you did that, it's just more than I could ever imagine and say. Thank you so much. Tab Talks wants to thank advertiser YesAmadiva.com. Their mission is to uplift, empower, and celebrate women of faith. In addition to their sassy bling custom tees, they have books, stationery, accessories, and more. You can follow YesAmadiva.com on Facebook, Instagram, Twitter, and TikTok. We can continue to tell stories that inspire and enlighten. Please go to www.thefield.org and select the Donations tab. Enter Tab Talks, and you'll see Dr. Michelle Pierce Mobley's name as the artist. Just use that portal to process your donation. Your donation is tax deductible and matching gift program eligible.